federal health officials announcing Americans who are fully vaccinated can stop wearing masks in most settings, outdoors and indoors.
If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment when we can get back to some sense of normalcy.
I think it's a great milestone, a great day. It's been made possible by the extraordinary success we've had in vaccinating so many Americans so quickly. To date, we've given out 250 million shots in 114 days. If you've been fully vaccinated, you no longer need to wear a mask. Let me repeat, if you are fully vaccinated, you no longer need to wear a mask. But if you've not been vaccinated, or if you're getting a 2-shot vaccine and you've not gotten you only had your first shot, but not your second, or you haven't waited the full 2 weeks after your second shot, you still need to wear a mask. The rule is very simple. Get vaccinated or wear a mask until you do.
Some states reacting immediately to the new CDC guidelines, with at least 8 governors already adjusting their state's mandates. But the governors of New York, New Jersey, North Carolina, and Virginia, all Democrats, said they are going to review the guidelines first before making changes. That is something many retailers plan to do as well, some saying they were caught off guard by the announcement. Joe, obviously this is all new, so states are going to take some time and figure out what works for them. Businesses who've had that sign, you have to wear a mask to come in, will have to decide whether or not they want to continue that policy. But the news is great. Unequivocally great news from the CDC that now we can take this massive step to returning back to normal life.
Yeah, it really is great news. And what have we learned, at least with the preliminary studies? We've learned that if you take the vaccine, chances are overwhelmingly good that you're not going to get COVID again. If you do get COVID, it's going to be most likely asymptomatic. We've also learned that outside, if you're outside, there is no need to wear a mask unless you really feel comfortable wearing that mask. There's just not. There's not medical reason to wear that mask. I was up in Boston a couple of days ago, Willie, doing what I usually do, going up and cursing the Boston Red Sox because they've been to 4 games this year. The Red Sox have lost all 4. Wow. They would, yes, I know. They
sure
would be 23-13 right now. No, in fact, last night in the first inning, Barnacle texted me after the Red Sox scored 7 runs. He said, we have taken a vote among everybody in the stands, and it is unanimous. You and your immediate family are to stay away from Fenway. But anyway, I'm going to slip in. I'm going to wear a bag over my head like the old New Orleans Saints fans. And hopefully, or I can be like Bobby Valentine, who, by the way, running for mayor of Stamford, Connecticut. How exciting is that? I can go in and wear a mustache or disguise. But anyway, I was sitting in the stands, and, you know, I actually talked to a couple of people that were involved with the team, and they said they had been following closely what happened in Texas, where they jammed, you know, capacity crowds in Arlington to the early games. And they said, we've been looking closely, and we just don't see, we don't see anything that came of that because it was outside. So, I mean, we're every day we're learning more and more about this virus, but certainly with 150 million Americans getting their vaccines, and we're going to talk to Philip Bump in a second. The slowdown of vaccines itself has appeared to slow down, and we're steadying off at 2 million a day. We're moving, we're not getting to herd immunity, but, man, we're improving every day. It is so great to hear the government say what a lot of us were starting to think, come on, we got vaccinated. Everybody we're around got vaccinated. Why are we still wearing masks? And you'd see some people wearing masks the size of Massachusetts a few days ago in public life. And you're like, what are you doing? What are you doing? You've been vaccinated. Everybody around you has been vaccinated. Let's get real. And yesterday, they did.
Yeah.
I'm gonna still wear them on planes, and I am.
Oh,
I think
yeah.
there's some value for them. We'll talk about that. There's still some problems with some people getting coronavirus, but we'll still talk about the value of the vaccine with that. Let's bring in White House reporter for the Associated Press, Jonathan Lemire, who was at the White House yesterday for President Biden's Rose Garden address. Also with us, national correspondent for the Washington Post, Philip Bump, with some analysis on how vaccinations are ramping up again, and director for the Center for Infectious Disease Research and Policy, and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. And Joe, within this conversation, there is the vaccines, if they help, if people still get the coronavirus with the vaccines, and then ultimately putting this economy back together again for the people who've been locked out.
Right. Well, I'm so glad, Mika, you talked about planes because, you know, I got a master's in broad generalities. But so let's be specific about this. If you're on airplanes, if you're on buses, if you're on public transportation, wear the mask. You still are expected to wear the mask. And actually, for your own health, you should still wear the mask. I got to say, in the future, I mean, I haven't gotten the flu in a year. Why am I going to start wearing a mask stop wearing a mask on planes? That just makes good common sense.
It's a good idea.
And let's bring in Dr. Osterholm, who has gotten this thing right all the way through. And it's so great to have you with us, Dr. Osterholm. I'm curious about some more caveats to yesterday's general announcement. What should Americans take away from what they heard President Biden say?
Well, first of all, it's incredibly good news, and it's news that we're not surprised by from a science standpoint. We now have 6 studies which actually show that once you're vaccinated, the likelihood of getting reinfected, and more importantly than serving as the person who might transmit to others, is very, very low. So this was based on good science, and I think we're moving forward. I think the challenge we have is the next step. The next step is we still have 42% of the U.S. adults have not been vaccinated. 64% have only had 1 dose of the 2 doses they need. And the challenge is going to be now we're worried that everyone's going to say, I've been vaccinated, and everyone will drop their mask in. So the next question is going to be is, how are we going to know if people are vaccinated? If you're sitting close to someone at a restaurant or next to them in a theater, how are you going to know that they're not just kind of fibbing a little bit here about whether they're vaccinated or not? And I think that's going to be the really next big question is, do we do these immune passports? Do we, you know, I gave up my eyeballs and my fingerprints to clear so I could get on and off an airplane sooner. Will people do that so that you can feel confident that the person you're sitting next to without a mask is in fact vaccinated?
Dr. Osterholm, as you think through this a little bit, because we've been talking about this since this news came down yesterday, exactly what you're saying about how do you know if someone is vaccinated or not, isn't that now the problem of the unvaccinated? In other words, if I'm vaccinated, my risk of contracting the disease again is very low, and if I get it, the symptoms won't be as bad, is what we hear anyway. So isn't that a concern more for someone who's unvaccinated than someone who is?
It actually is. You're absolutely right. But the problem is when you have 42% of the U.S. adults not vaccinated at all, and you have 64% that only have 1 dose, we could still see substantial transmission of the virus in these smaller groups, cases of, 50, 60, 70 people getting infected. So we want to make sure that they don't get infected, too. So I fully support the administration's efforts to get more people vaccinated. I think they really deserve tremendous credit for what they've done in the last 114 days. I was on the Biden-Harris transition team on COVID-19, and we had debates back in November and December. In fact, should the president put out a 100 million dose goal in the first 100 days? And he said yes, and then the administration went to work with the industry, and they did a remarkable job of getting us 250 million doses out in 114 days. So I think this has been great news. We just have to get the remainder of these individuals vaccinated, or we could still see substantial activity in this country. Look no further than the Seychelles, the most vaccinated country in the world right now. Right. And grant you their vaccines may not be quite as effective, but they're in a lockdown as we speak this morning just because of the fact that in that unvaccinated group, we're still seeing real transmission issues.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.